Ever wondered what common diseases or illnesses could affect your newborn baby within the first 6 months? Well, you're not alone. Many new parents share this concern. In this video, we will discuss the most common health issues that can affect babies from birth to 6 months. We'll shed light on what symptoms to look out for, the basics of first aid for babies, when it's time to seek medical attention, and how over-the-counter medications can be used safely. But remember, every child is unique and what works for one may not work for another. Also, while we strive to provide accurate and helpful information, this video should not replace professional health advice. Always consult with a healthcare professional for any health concerns about your baby. So, buckle up. Stay with us as we delve into this vital topic. First, let's look at some of the common diseases that could affect your little one. In the early stages of life, babies are particularly vulnerable to certain ailments. The first one we're going to discuss is colic. Colic typically appears in the first few weeks of life and can cause bouts of intense, inconsolable crying, often in the late afternoon or evening. It's not clear what causes colic, but it's thought to be related to gas or other digestive issues. Next is diaper rash, a common skin irritation that occurs in the diaper area. Is usually caused by extended contact with wet diapers and can result in red, painful skin. Changing diapers promptly and using a zinc based cream can help prevent and treat this condition. Then we have infant jaundice, a condition that causes a yellowing of a newborn's skin and eyes. It's usually caused by an excess of bilirubin, a yellow pigment produced during the normal breakdown of red blood cells. Most cases of infant jaundice resolve on their own, but in some cases, it might require medical treatment. Another common condition is thrush, a yeast infection that can occur in the mouth, resulting in white patches on the tongue and inside the cheeks. It can be uncomfortable for the baby and can interfere with feeding. Finally, let's talk about the common cold. Babies can catch colds just like adults, and symptoms include a runny nose, cough, and mild fever. It's important to keep the baby comfortable and hydrated and to seek medical attention if symptoms persist or worsen. These are just a few examples of common diseases in babies. Each baby is unique and so is their health. It's important to note that while some conditions are quite common and often harmless, others may require prompt medical attention. Remember, this information doesn't replace the advice of health professionals. Always consult with a healthcare provider if you have concerns about your baby's health. Knowing these diseases and their symptoms is the first step in ensuring your baby's health. Now that you know what to expect, what are the symptoms to look out for? Well, let's dive right in. For common colds or respiratory infections, you'll notice a runny or stuffy nose, a mild fever, and perhaps a bit of a cough. Your little one might seem irritable or have trouble sleeping, and who can blame them? But then there are ear infections. These can be a bit trickier to spot, but some telltale signs include tugging at the ear, trouble sleeping, and a loss of appetite. If your baby seems unusually fussy, it could be an ear infection. Moving on to gastrointestinal problems, like gastroenteritis. Symptoms include vomiting, diarrhea, and dehydration. You might notice fewer wet diapers than usual, a sign that your baby might not be getting enough fluids. Next up, thrush, a yeast infection that commonly affects infants. You'll see white patches in your baby's mouth, that don't wipe away easily. Your baby might also be reluctant to feed, which can be another sign of this condition. Last but not least, let's talk about skin conditions. Babies have sensitive skin, and rashes or eczema can occur. Look for red, itchy patches on the skin, often on the cheeks, arms, and legs. Now, it's crucial to remember that babies can't tell us what's wrong. They rely on us to notice these signs. It's a lot of responsibility, but don't worry, you've got this. Take note that these symptoms can also be signs of other illnesses. So, if you notice any of these symptoms, it's always a good idea to consult with a healthcare professional. They can give you a proper diagnosis and guide you on the best course of action. And remember, while it's important to be vigilant, it's also important not to panic. Many of these conditions are common and treatable. It's all part of the journey of parenthood. Remember, early detection could make a significant difference. Keep those keen eyes open and trust your instincts. You're doing great. What immediate steps can you take when you notice these symptoms? That's the question we're tackling in this segment. Remember, your initial response can make a significant difference in your baby's comfort and potentially their health. Let's start with the basics. When dealing with a colicky baby, your first line of defense is soothing techniques. A gentle rocking motion, soft humming, or a quiet, calming environment could work wonders. Some parents also find that a warm bath or a gentle massage can help. Now, on to diaper rash, a common irritant for little ones. Your initial response should be to clean the affected area gently. Use warm water and a mild fragrance-free soap. Avoid vigorous scrubbing, as it can further irritate the skin. After cleaning, allow the area to air dry before applying a diaper rash cream. Look for a cream that contains zinc oxide, which forms a protective barrier on the skin. If your baby has a fever, the first aid response is to keep them hydrated and comfortable. Offer plenty of fluids and dress them in light clothing to help lower their body temperature. Do monitor the fever closely, and if it persists, do not hesitate to seek medical attention. In the event of minor cuts and scrapes, clean the wound with warm water and mild soap, then apply a gentle hypoallergenic bandage. For more severe injuries, it's best to seek professional medical help immediately. Remember, these are first aid measures, not treatments. They are meant to provide initial relief and prevent the situation from worsening while you seek professional help. It's also important to note that every baby is unique. What works for one might not work for another. As parents, you'll learn your baby's cues and what soothes them best. Trust your instincts, but also don't hesitate to seek advice from professionals or more experienced parents. While first aid can help, it's crucial to know when to seek medical attention. We'll dive into that in our next segment. Stay tuned. So, when should you rush your baby to the doctor? Well, there are several signs that indicate your baby might need immediate medical attention. It's important to stay vigilant and act promptly, as your baby's health might be at stake. One of the most apparent signs is a high fever. For a baby younger than 3 months, a rectal temperature of 100.4 degrees Fahrenheit is a definite reason to call your pediatrician. If your baby is between 3 to 6 months and has a fever of 101 degrees Fahrenheit or higher, it's time to seek medical attention. Another red flag is persistent crying or a significant change in your baby's crying pattern. If your baby cries for 3 hours or more and cannot be consoled, it may be a sign of a serious health issue. Similarly, if your baby's cry becomes weak, high-pitched, or sounds different than usual, it's crucial to consult with a healthcare professional. Unusual lethargy or unresponsiveness is also a cause for concern. If your baby is hard to wake up or doesn't react as usual to your touch or voice, it might be a sign that something's not right. In addition, keep an eye out for changes in your baby's eating or sleeping patterns. If your baby suddenly starts eating or sleeping significantly more or less than usual, it's worth having a chat with your pediatrician. Also, be on the lookout for any changes in your baby's breathing. Rapid breathing, wheezing, grunting, or flaring nostrils could be signs of a respiratory problem that needs immediate attention. Lastly, any rash, especially one that is accompanied by a fever, should be evaluated by a doctor. While many rashes are harmless, some can be a sign of a serious infection. In conclusion, trust your instincts. You know your baby better than anyone else. If something doesn't feel right, it probably isn't. Never hesitate to seek medical help when your baby's health is on the line. Are there any over-the-counter medications that you can use? A question that might have crossed your mind a time or two. Indeed, there are a few over-the-counter medications that can be used for babies, but it's crucial to use them with caution and always under the guidance of a healthcare professional. First off, for minor discomforts like teething or a slight fever, you might consider using a mild pain reliever such as acetaminophen. This is typically suitable for infants over 2 months old. However, it's essential to follow the dosage instructions on the label and consult your pediatrician if you're unsure. Next, let's talk about colds. Babies are prone to them, and while they can't take decongestants, saline nasal drops are a safe option. They can help relieve stuffy noses and make it easier for your little one to breathe. We also have antihistamines which can be used for allergies or mild reactions. Again, these should be used sparingly and only under the guidance of a healthcare professional. Remember, antihistamines should never be used to make a child sleepy. For babies with colic or gas issues, infant gas drops can be a lifesaver. They can help alleviate discomfort and are generally safe to use. However, if the colic symptoms persist, it's time to pay a visit to your pediatrician. On a final note, topical creams and ointments for diaper rash or minor skin irritations can also be found over the counter. These are generally safe to use as directed on the packaging, but do avoid application on open wounds or broken skin. Now, while these are some of the commonly used over-the-counter medications, it's important to remember that every baby is unique. What works for one might not work for another. Also, over-the-counter doesn't necessarily mean safe, so avoid self-diagnosis and self-treatment. Remember, always consult your pediatrician before giving any medication to your baby. They are the best guide when it comes to your baby's health, and they can provide the most accurate dosage and medication suitable for your little one's specific needs. What are some of the do's and don'ts when it comes to your baby's health? Let's dive right in. One of the most important do's is keeping your baby's environment clean. Hygiene is crucial in preventing many common ailments. Be sure to sanitize toys, feeding bottles, and anything else your baby might come into contact with. Now, on to a critical don't. Never self-diagnose your baby's condition. While it's important to be vigilant about your baby's health, remember that you're not a doctor. If your baby is showing signs of illness, the safest course of action is to consult a healthcare professional. Another do, trust your instincts. If something doesn't seem right, it probably isn't. You know your baby best. Don't hesitate to seek help or advice when you're unsure. On the flip side, don't ignore or downplay symptoms. A minor symptom in an adult could be a significant indicator in a baby. If your baby has a persistent cough, unusual rash, or irregular bowel movements, it's time to call the doctor. Do ensure your baby is on the right vaccination schedule. Vaccines are a proven way to protect your baby from several serious diseases. Be proactive in discussing your baby's vaccination schedule with your healthcare provider. And a crucial don't expose your baby to unvaccinated individuals. Babies have a developing immune system and are more vulnerable to diseases. A final do. Regularly monitor your baby's growth and development. Regular checkups allow healthcare professionals to spot any potential issues early. And the last, don't. Never leave your baby unattended, especially when they're eating, bathing, or sleeping. Babies are curious and can easily get themselves into dangerous situations. Remember, these do's and don'ts are not exhaustive. Each baby is unique, and what works for one may not work for another. Always consult your healthcare provider for personalized advice. These guidelines will help ensure your baby's well-being. Guys, as we wrap up, let's revisit what we've covered today. Today, we've journeyed through the world of common diseases that can affect babies from birth to 6 months. We've learned about conditions such as colic, diaper rash, and the common cold, to name just a few. These diseases, though common, can be alarming for new parents, which is why understanding them is crucial. We've also discussed the various symptoms to be on the lookout for. Remember, unusual crying, fever, or changes in your baby's eating or sleeping patterns can all be signs that something's not quite right. Always trust your instincts and keep a watchful eye on your baby's behavior. We've delved into first aid for babies, emphasizing the importance of acting promptly and correctly to ensure your baby's safety. From how to respond to choking incidents to dealing with fevers, knowing basic first aid is a must for every parent. Our conversation also touched on when to seek medical attention. While it's normal for babies to have minor illnesses, certain symptoms should never be ignored. High fevers, persistent vomiting, or difficulty breathing are all red flags that warrant immediate medical attention. We've explored over-the-counter medications, highlighting that not all are suitable for babies. Always read labels carefully, and if you're unsure, consult with a health professional. We've also outlined some do's and don'ts for new parents, providing you with practical tips to ensure your baby's well-being. Remember, while it's important to keep your baby clean and comfortable, it's equally essential to give them love, care, and attention. Lastly, we've emphasized the importance of closely monitoring your baby's health. Regular checkups, maintaining vaccination schedules, and keeping an eye on your baby's growth and development are all part of this process. Remember, your baby's health is paramount. Always consult with a health professional. When in doubt, thanks for watching.